Bismillahirrahmanirrahim. Assalamu alaikum. Here is Dr. Fahad. Today we will discuss about the dental caries. So if you are new to my channel, welcome to my channel, and inshallah I will keep trying to make new videos related to my profession, and that is dentistry. So now let's begin with first video, dental caries. Dental caries is basically the destructive process in which the decalcification of the tooth enamel occur, and this continuous decalcification leads to destruction of the enamel and dentine. When enamel is destroyed and the dentine is destroyed, so there is a cavity is formed in the tooth. So cavitation of the tooth is formed, and this is the dental caries is basically irreversible process. So the cavity is formed, so now it is no chance to be this to reverse the dental caries. And initially when the first white spot is present on the tooth, especially on the enamel, so at that time it is reversible, and when it is reversible, that time it is known as incipient caries. So at that time it is reversible, but when the cavity is formed, so the dental caries become irreversible. So dental caries is basically irreversible tooth loss in which the decalcification of the enamel and dentine occur, and at the result the cavity is formed. So it is like this. It is a healthy tooth, the enamel is okay and everything is okay, and now the tooth decay start initially from this area, from this fit area, and now it involve only enamel, and then it also cause the destruction of the dentine, and now it is involving the pulp. So the cavity is already, so the deep caries is like this. These are the caries and these are the deep caries which are already involving the dentine. So the caries is basically destruction of the enamel and dentine, and then involving the pulp, and then so then the pulp, when the pulp is involved, the pulp will be inflamed, so it will be causing the pulpitis. So we will discuss one by one these. What is the pathogenesis behind the dental caries? So how the development of the caries occur? What is the pathogenesis? Basically the plaque is present on the tooth surface. So what is the plaque? Plaque are the food debris which are present on the tooth surface. When there is bad oral hygiene, the tooth are not clean, so these plaque accumulate on the tooth surface, and the plaque contain bacteria. So these bacteria, what they do, they metabolize the carbohydrate. Means that food particle which contain the sugar, which contain the carbohydrate, that are metabolized. At the result they will make what? Lactic acid. When that sugar is metabolized, so at the result lactic acid is made. So that lactic acid is basically acid, and that acid start, and these cause demineralization. Main thing which is involved in the development is the plaque. So basically the plaque is the initial start. When the plaque are not clean, so this plaque continue to form the lactic acid in the presence of the bacteria, and this is called demineralization, and the cavitation is formed. So here we will come to the caries. Here are the two tooth quality. If the poor oral hygiene is there, so what there will be there? The poor oral hygiene, there will be present of the carbohydrate will be there, sugar particles will be present in the presence of the bacteria, Streptococcus mutans. Initially causing caries on the enamel is Streptococcus mutant. We will discuss in the coming slide. And with the time, so this called in the presence of this, they make the acid and they cause the caries. If there is good tooth quality, there will be no carbohydrate, no bacteria will be there, and there will be no caries. So with the time it proceed. So now we will come to the etology. What is basic etology behind this? The dental plaque contain microorganisms. So now remember from exam point of view that these three things like Streptococcus mutant is there, which are the initially causing enamel caries. So if somebody asks the question about the what caries are initially caused by which bacteria, so initiation of the caries is by the Streptococcus mutant, And now then by the lactobacillus, which cause the dentinal caries, the dentine caries, and it proceed and continue this one. And actinomyces is due to exam point of view, I have here this actinomyces causing the root caries. So these are the three main basic bacteria which are involved in the dental caries, which are present mostly Streptococcus mutan causing the enamel caries, Lactobacillus causing the dentinal caries, and Actinomyces causing the root caries. And the second important thing is the diet. If the diet is carbohydrated diet, so there will be more sugar. Sugar will metabolize to the lactic acid in the presence of the bacteria and causing lactic acid, causing increasing the acid concentration, and that acid will cause the demineralization. So sticky food is one of the major factor, and frequency of the intake, how much carbohydrate is intaken by any person, any child. And the third thing is the time. If more time, so definitely with the sugar, if you are taking a lot of sugar and for high duration, so it will definitely, these three factors are the main factor, and these are the factor which are related with the patient on. If the patient slava is there, if the patient is diabetic, so the slava concentration will be decreased, and there will be increased rate of the caries though. So there will be high caries risk in these patients, especially diabetic patient, because the slavery concentration is decreased. And if the person is smoking, and due to the smoking also the slava concentration decrease. And socio-economic condition is also related with these conditions. And tooth, which tooth is there, if molars are most they are prone to the caries. And immune system, if your immune system is weak, and definitely there will be the chances to grow the more bacteria, more caries will be there, more bacteria will be there. So definitely the caries will be. Also awareness and education, these two factors increase the oral hygiene. If there is proper oral hygiene, there will be no presence of the carbohydrate or plaque on the tooth, so there will be no caries. GV black classification is very very important from exam point of view. Most of the time examiner ask about this and give the example and ask from you that which kind of class this is. So you must remember GV Black was an American dentist, GV Black, so it is related with his own name. So now we will come to the class 1. First of all, I will tell you that GV Black has made 6 class. The first thing that GV Black doesn't explain is not involving the root caries. So GV Black only explain about the crown, the coronal caries, the present on the crown, means the visible tooth. So it is explaining that. So you must remember that GV Black doesn't explain about the root caries. And now we will discuss about the class 1 caries. So the class 1 caries is basically occlusal surface. It is present on the occlusal surface of the posterior tooth. So the posterior tooth are basically the molars and the premolars and the molars. So when the caries are present on the posterior tooth occlusal surface, so you will say that biting surface, occlusal surface, you will say that it is class 1 caries. And also it is also known as the pit and fissure caries. So it is mostly present on the pit and the fissure, which are present on the occlusal surface. And the second thing is it is also present on the buccal and the lingual pit of the molars. So this is the buccal pit, and here it is, if the caries are present here, so it is also counted, it also come in the class 1. And also the lingual pit near the cingulum of the maxillary incisor. So this is the maxillary incisor, this is the cingulum area, the raised area at the lingual side. So this is the lingual pit. If the caries are present here, so it is also coming in the class 1. So you will say that class 1 caries are the caries which are present on the occlusal surface of the posterior tooth, and also the buccal and the lingual pit of the posterior tooth, and also the lingual pit near the cingulum of the maxillary incisor. It is already, these all are coming in the class 1 caries. And now we will discuss about the class 2. The class 2 is very simple. Proximal surface caries. What are the proximal surfaces? Mesial and the distal. This is the mesial side and this is the distal side. The mesial side is the side of the tooth which is near to the midline, and the distal which is away from the midline. So definitely here this side will be if here is the midline, so this side will be the mesial and this side will be the distal. So this is basically, these caries are, if it is present here or here, so it come in the class 2 caries. So proximal surfaces of the posterior tooth coming in the class 2 caries. And class 3 caries, the proximal surfaces of the interior tooth. Proximal surfaces of the posterior tooth, class 2, and proximal surfaces of the interior tooth. So therefore I have made in the red sign that you must remember class 3 is the proximal surfaces of the interior tooth. So the proximal surfaces are the distal and the mesial. So so the caries which are present on the mesial side are on the distal side of the interior tooth coming in the class 3. So you will say that it is class 3 caries involving the interior tooth. And but one thing you must remember, but it doesn't but not involve the incisal line angle. So now this is the incisal line angle. If this line angle is involved, so if this line angle is involved, so it is not including in it is not coming in the class 3. So then you will go to the class 4. We will discuss that one. So now class 4 caries are interproximal surface caries of the interior tooth, interproximal surfaces, and you can also proximal surface caries of the interior. But one thing you must remember, it including the incisal corner, the incisal line angle. Now these caries are coming in the class 4. Now these involving the incisal line angle along with the proximal surfaces. So if this kind of caries is given to you in the exam, or this kind of the figure is given, so you must remember that it come in the GV Black class 4. So the proximal surface caries of the interior tooth involving the incisal line is coming in the class 4, and if not involving the incisal line angle, so it will be in the class 3. So it is not involving, and this is the involving the incisal line angle. And now we will come to the class 5. The class 5 is very different, and you must remember one thing, that it is present on the cervical area of the crown. This is the crown and this is the cervical area. Also the people some people call it the gingival third. So if the caries are present at this area, so this is known as class 5 caries. Class 5 caries is involving the cervical area of the crown. If that is facial, that is lingual, so involving the cervical area, so that we will calling the GV Black class 5 classification. And now we will come to the last one, and that is the GV Black class 6. And the class 6 is totally different from all, because it is present on the very top of the occlusal surface. So the very top will be definitely, these will be the cusp, these cuspal area, this cuspal cusp involving. So we will count this in the class 6, GV Black class 6. And also incisal edges of the all interior. If this incisal edges also involving the carious lesion, or caries are present at this area, so we will also count in the GV Black class 6. So class 6 caries are the caries which are present on the very top surfaces of the tooth. So that is the occlusal areas. These are definitely on the occlusal area. And thank you so much for watching my video, and keep supporting and subscribe my channel for upcoming new videos, inshallah. Thank you so much.